Before I get into the topic of my presentation, please take a moment to empathize with this scenario. Imagine your significant other of 2 years has decided to end the relationship seemingly out of nowhere. How would you feel and how would you react? Some of you may say that you would be able to control your emotional reaction and be able to respond calmly to the situation. However, some of you may feel overwhelmed and like you have no control over your reaction. That is where a psychotherapy approach known as dialectical behavioral therapy can be helpful. Today, I will be talking about dialectical behavioral therapy and how anyone can benefit using it as a tool. In order to fully understand DBT and how it can be an effective tool, we first need to discuss why DBT was developed by psychologists and what exactly DBT is. So what does the word dialectical mean? We'll answer this question in just a little bit. This psychotherapeutic approach was developed by psychologists in the 1970s when they realized they needed a different approach for treatment for their clients who struggled with chronic suicidal behaviors and borderline personality disorder. Diffham and Lineham, 2001. Borderline personality disorder is a psychological disorder caused by trauma in early childhood and is characterized by a severe inability to regulate emotions. Black and white thinking is also very common. Before DBT, the main therapeutic approach used by psychologists was cognitive behavioral therapy. This is a therapeutic approach that aims to change the individual's problematic thoughts and emotions in order to change their behaviors. Wenzel and al. However, this made their chronically suicidal clients and clients with BPD feel invalidated and ultimately destroyed the provider-client therapeutic relationship. So it became crucial to develop a technique that focused on acceptance of emotions to change behaviors rather than just change. Now that we have discussed the brief history of why DBT was developed, it is time to discuss what DBT actually is. In DBT, the goal is to learn to understand, accept, and have compassion for your emotions as a tool for implementing behavioral change. Acceptance, in this sense, according to Dr. Salters Pinault, means that you practice allowing your feelings to be what they are without trying to judge them or changing them. So dialect, in this case of dialectical behavioral therapy, refers to the therapist's position in balancing the two conflicting ends of the client's black and white thinking as true with acceptance and change. For example, have you ever experienced negative emotions and told yourself that you're overreacting or being overdramatic? That would be an example of not being accepting. There are 4 stages to DBT treatment. Stage 1, according to Linehan and Wilkes 2015, this stage, stabilization and behavioral control are the main priorities because in most cases, clients are dealing with co-occurring psychiatric problems. For example, this may look like decreasing self-harming behaviors, decreasing behaviors that interfere with therapy, such as attending sessions, and or decreasing behaviors that inhibit the quality of life of the client, such as substance use. In stage 2, this stage is often referred to as the quiet desperation, because even though the client's problematic behaviors are controlled, the emotions are not. The main priority during this stage of treatment is for the client to fully experience all of their emotions. In stage 3, the primary focus is to improve the quality of life by reducing ordinary problems of living, Linehan and Wilkes 2015. And in stage 4, this is the final treatment stage where the goal is for the client to feel a sense of completeness and transcendence. Even though DBT was originally developed to help patients with BPD, let's discuss how DBT can be helpful for those without BPD or any other serious psychiatric problem. A study on Iranian participants with anxiety found that DBT did not reduce symptoms as well as CBT, but DBT was significantly better at increasing emotional regulation and mindfulness. This study was done by Afasari and Hassani in 2020. Mindfulness teaches us how to respond to stress with an awareness of what is happening in the present moment rather than simply acting instinctively, unaware of what emotions or motivates may be driving that decision. Kind and Huffman, 2016. So for example, instead of increasing feelings of anxiety because you feel negative attitudes towards the feeling of anxiety, DBT teaches you how to accept your anxiety and realize not only the psychological feelings of anxiety, but also the physical sensations as well. So tight chest, shortness of breath, shakiness, nausea, etc. And that recognizing these sensations can give you the emotional power to overcome the anxiety in the present moment. This was my brief overview on the purpose and effectiveness of dialectical behavioral therapy. By using DBT techniques either in therapy or on ourselves, we can improve our emotional reactivity and mindfulness. This is just one therapeutic approach that could possibly be used. There are many other approaches used and integrated in clinical practice. If you are interested in receiving therapy, you can check out the Universities of Northern Iowa's Counseling Center, which is located on the second floor of the Student Health Center, right next to Schindler Education Building.